And what is it, environmental triggers? It could be perinatal factors. We talk about that on previous part of the lecture. It's higher maternal age. It's increased birth weight. It's preeclampsia during a pregnancy. It's neonatal respiratory distress and other problems, etc. So it's perinatal factors. It could be other factors like environmental factors such as viral infection or such as vaccination, and even cow milk or even cereal exposure, other toxins, nitrates, etc. So something should happen, plus genetic predisposition. We have autoimmune reaction. As you can see on these slides, this autoimmune reaction, autoimmune response in islet B cells, it's mostly going through different processes like auto antigens and beta cells, B lymphocytes, B cells, and inflammatory cytokines way. So in that case, it will be involved interferon gamma or tumor necrosis factor alpha or interleukin 1-6, etc., or other major cytokines produced by pathogenic T cells that leads to destruction of beta cells. In that picture, you can see B cells also activation leads to formation of autoantibodies. It's autoantibodies against various islet autoantigens. So it's a huge process that right now I just wanted to highlight the difference between type 2 and type 1 diabetes. Type 1 diabetes, it's about autoimmune reaction, about genetic predisposition, some environmental triggers, and specific reaction of our body on it. So at the end of this scheme, you can see that it's beta cells damage, and you have to keep in mind the difference between these two types, because the treatment will be different, and that's a point why I try to put them together, and you will see the difference in one moment. So right now I'm gonna talk only about type 2 diabetes, to not mix up both of them in your mind. We find the difference between two types, and as you have seen in the video, type 2 diabetes go through two processes. It's insulin resistance and it's beta cell dysfunction. And as this small video showed you, the most important part in early stages is insulin resistance. When we talked about obesity, about metabolic syndrome, it was a red line everywhere, insulin resistance. On this part of the presentation, I would like to stop on insulin resistance changes in every organ, in target organs. It's liver, it's skeletal muscles, and it's adipose tissue. You can observe the major tissue responsible for glucose uptake and metabolism in these slides, what I will show you. So these three organs are responsible for glucose uptake and metabolism. That's first. other we have to remember that insulin resistance, that condition means that cells in these organs fail to respond properly to insulin, and that can lead to reduced glucose uptake and increased blood sugar level. That's what I wanna right now that you will keep in your mind. So the pancreas tried to compensate this, it's tried to produce more insulin, etc. And over time, it will lead to beta cells dysfunction and to severe stages of diabetes. So step by step, but everything starts from insulin resistance. As you can see on this slide, it's very simple.